Okay, I think we give it a start now. Thank you everyone for joining us today on this all system workforce planning webinar, transformation webinar. I'm Olu Akinremi, the Senior Transformation Program Lead within Adnan James CSU. And I've also got as a co-presenter today, Colin Leary, an expert workforce planner, which I will give him a moment to introduce himself. Colin, please, can you introduce yourself, please? Thank you.
Yeah. Hi, my name is Colin Lurie. I'm a workforce planner, as Olu says. I've been workforce planning since about 1994. I'm an ex-director of PwC, partner of Finnemore and senior partner at GE. I've developed workforce models and undertaken transformation in lots of different industries, including retail, ferry company, logistics, and health and social care. I'm also the director of the WRAPT tool in the UK, the TAKAR tool in Saudi Arabia, and I'm a visiting fellow of the University of Suffolk, teaching workforce planning as part of a postgraduate course.
Thank you very much, Colin. And just for our colleagues joining the webinar, please feel free to put in your roles, your organization in the chat as well. That would be helpful, just a sort of introduction so that we know you. And there'll be any comments in the chat will be attended to as part of the program. And after the presentation, we're going to be taking questions as well from the floor. So yeah, then I'll just kickstart. I'll just share my slide. Can everyone see my
Yes,
my slide? Yeah. So we are Adnan James CSU. We are part of the NHS. We are part of NHS England, and we work collaboratively with other CSUs in the country, and about 4 of us in the country. We deliver value-adding back office services for NHS England, and we provide clinical and transformational support at scale for the NHS as well. So we operate with full national coverage, and we are aligned with every integrated care board across the country and NHS England regional offices. So we are designed to support NHS England and local NHS body to achieve their ambitions. And today we are looking at all workforce planning transformation, which has been the need of the hour for the NHS really, because now is the time for ICB and providers to take a hard look at their workforce and spending. As we all know in recent events that we've had from NHS England. And according to their guidance, plans must align with quality objectives and must be cross-checked across activity, workforce, and finance. And by doing so, we ensure sustainable, high-quality care for everyone. And this is included in the 25-26 priorities and operational planning guidance as well. And just as saying, this is also an opportunity for us as NHS organizations. Leaders recognize that there are siloed planning. This current siloed planning often misaligns with capacity, with funding, with staffing as required. And as we move from strategic outlines to live operations or BAUs, workforce planning must be continuous and connected. So what this platform gives us is an opportunity, to have to meet that, to ensure workforce is placed at the forefront and center, offering those real-time analytics and forecasting that keep organizations agile, modern, and appropriately staffed for the future to serve patients better. So, and what is connected planning? How does the connected planning help with this? What connected planning does is it brings together those clear objectives for example, the triple aim agenda, helping to drive those decisions that are important, like improved population, efficient use of resources, with having those right stakeholders in place from regions, from systems, from departments, trust, place across the country, and other organizations across the country, working together as multi-organizations. So, and this is done through dynamic assurance, by continuously aligning finance with workforce, with activity, and this shifts planning from just a multi-year strategy to monthly cycles, ensuring that we have that agile and data-driven decision-making for better outcomes for the NHS. And what we've noticed that there's as mentioned earlier, there's this traditional siloed planning, which leaves key questions unanswered, like which roles do we need to fill a particular set of activities, and how do we shift resources efficiently to make sure we have the workforce covered. And connected planning, what connected planning does for it is aligns all these different areas, finance, workforce, and even the clinical outcomes and activities under one unified strategy. And this is done by integrating data and decision making to ensure that it's workforce readiness. And what this leads to is the optimization of costs and ultimately delivering the better patient outcome for us all. So, and there's this interoperability when we connect workforce and systems together. This interoperability unites workforce and operational data to drive smarter decisions. By integrating electronic health records, for example, and enterprise resource planning platforms, and even HR systems, organizations can align financial, clinical, and staffing strategies in real time. As can be seen here on the screen right there, these tools boost efficiency, they reduce agency costs, and they lower turnover, unlocking sustainable performance and gains, and improving the patient outcomes as well. And what we have here is a sort of architecture that provides a single source of truth by consolidating data from multiple systems, from your FDP, from ESR, from local data sources within organizations, NHS organizations. From there, integrating this into the Anaplan Data Hub and covering workforce, finance, and performance productivity models, and transforming this raw data into actionable insights and allowing users to view, share results in real time through the Anaplan interface or the enterprise management interface or Power BI or Excel. So you can share your results or the outputs of this data at board level, department level, and view what's going on in real time across the organization. And what is this integrated planning process? It's just like imagining a single environment that unifies all your critical healthcare planning elements. That is your demand and activity, your workforce, your financial projections, your performance, your productivity metrics. And in this integrated model, each component fits into a central hub, ensuring that every plan is informed by the most up-to-date data. So from population activity trends to performance and productivity measures, to workforce plans, to finance plans, to the finance details, and the system dynamically recalculates and forecasts as new information comes in. So decision makers can then use scenario modeling to explore what-if possibilities and adjust strategies before they become problems in the real world. So finally, you have an assurance dashboard that offers continuous oversight so that leaders can track all these, they can track the progress, and they can make evidence-based updates or decisions to make sure all their plans are in sync, are connected. And by connecting every facet of planning, organizations can deliver better outcomes for patients, optimize resources, and stay agile in an ever-evolving healthcare landscape. And narrowing this down to the workforce in the integrated model, the workforce planning goes beyond just simply counting the staff. It draws in real-time data from activity, productivity, and performance metrics. It helps to ensure that the right people are in the right place at the right time. So the system recalculates as conditions shift, allowing leaders to run what-if scenarios and quickly adapt their plans. So, and having the assurance but to monitor and anything that is flagged up, and maybe successes as well that it can be visualized. So ultimately, this connected approach keeps organizations agile, ensures the staff are optimally deployed, and supports better patient outcomes for the NHS. So to achieve this, we've gone, Adina and James CSU recently led a national procurement for NHSE with NHS England to pinpoint best-in-class planning solutions. And the two that have come on top, if you can see them at the top right, is the Anaplan on Oracle. And after thorough evaluation, we secured national contracts with Anaplan on Oracle, EPM Cloud. Now we are collaborating with these vendors to develop prototype planning models, ensuring the NHS is equipped with efficient data-driven tools for the upcoming annual planning cycle. So just right now, I'll pause for a moment now. If there are any questions, then I will allow Colin to go ahead and do his part of the presentation. Thank you, everyone.
Shall I move on then, Olu?
I think we've got a hand up. Then we allow you to come on. We've got a hand up from Yasmina.
Yes, hi there. Hi, thank you. It's Yasmina Gaynor from George Eliot, Coventry and Warwickshire, ICB. Just a very quick question. Sorry if I hadn't read some documents or something. Is this an ICB tool or is this a provider tool? Yes. What are we talking? At which level is this best implemented, please?
Yes,
thank you.
Thank you very much for that question, Yasmina. This tool can be used at the ICB level, also at the organizational level, and also at the department level. So within the tool, there's a level of hierarchy. You can maybe a top, roll this one up and down, different, even at the system level, this could be used as well. And also you can roll it all the way down to department level or directorate level to use the tool across those different functions. So you can use at both an ICB level and at provider level.
Thank you. Thank you. That's really useful. And is this a self-made, man-made tool within your own CSU, or is this a off-the-shelf product on the market? Thank you.
Okay. Yes, it's something that we have developed as a CSU, working in partnership with SMEs across NHS.
Okay, thank you so much.
So it's NHS, for the NHS, where for the NHS, the tool is being
built for the NHS. Yes. Thank you so much indeed. Thank you.
Thank you. So if we could take further questions maybe at the end of the meeting, so I'll allow Colin to go on, which is part of the presentation. Thank you.
Thanks, Ollie. So I've been helping the team to develop the workforce element of the system, but I just wanted to take us back a little bit to the topic of whole system workforce transformation and where this fits within that and what it can help solve. And because people do tend to fall asleep while I'm talking, I will ask a question in about 5 minutes just to get your thoughts on things, really around what the barriers are that you find to workforce planning and to workforce transformation. Just to start things off, we will just briefly talk about what workforce planning is and its breadth and therefore where whole system workforce transformation fits. We'll also think about the barriers to it. And why it is practically impossible the way we work at the moment, and how integrated planning and the system that the team have developed are developing can help. I'll also flag other resources at the end. Workforce planning has got many, many definitions, but the NHS, back when Health Education England was a thing, had a great definition for it, and one that we still use in any industry we work in. It's to support excellent delivery by ensuring that the workforce of today and tomorrow has the right numbers, the right skills, the right values, and the right behaviours at the right time and in the right place. And a colleague who I was working with in training, Graham Seward, who's the ICB workforce lead for SNE, Suffolk and North East Essex, has also added at the right cost over the last year, because of course that's become very, very important. So it's a very, very broad explanation. It's about making sure basically that you can match what you need today and tomorrow to meet demand with the right skills, values and behaviours. And so there's a lot in it, and we'll look at the breadth in a second. The reality of workforce planning is, though, that we operate in a world where there are competing agendas. We have got the needs of our staff, and our staff want money, yes, but and other benefits, but they also want a fulfilling career. They want to know that their career is planned, or they have the next steps they might want to take for their career. They want to be appreciated. They want time for development. They want time to have agency over the way their processes work. So the needs of staff are important. And of course, they want enough staff to do the job, which is often where the challenge comes in. Secondly, you've got your service users. There is a need to make sure that our patients, our customers, our service users are getting the access that they need. They want quick access to health and care. They want to make sure that they are have that close to home, and etc. They want good quality. And then the organization itself, by which we could think about the senior management, if that's too prosaic, they do want their staff to be happy. They often want their service users to be happy. They may want a range of things, but at the moment, what we're seeing is it's often about making sure that we are meeting budgets or reducing costs. And the only way to square those circles, as it were, or to triangle those circles, is through efficiency, because if we are massively efficient, then we can afford to make sure we pay our staff and have enough staff. We can make sure we deliver care to everybody quickly, and we can meet our budgets. So a lot of our work around workforce planning is around working out how we can improve efficiency and maximize efficiency. So that's what workforce planning is, but it's a massively broad area. And workforce transformation, system-wide workforce transformation, is part of that, but it's not the whole picture, but it does fit within it. On the left-hand side is a sort of quick view about what it includes. On the right-hand side is a screenshot from a website called the Association of Health and Care Workforce Planners or Planning, which is a free-to-use membership, a free-to-join membership organisation, which focuses on supporting people that have the word workforce in their titles, largely anyone working in workforce planning and health and care. And it is also about providing training and development materials in that area. And that's how they define the skills required for workforce planning. So it is massively broad. It includes things like workforce redesign, of which we've got the NHS largely approaches there, STAR, CLEAR, 6-step, RAP redesign. Notice Helen is a Calderdale practitioner. Calderdale would fit in the other box, of which there are many others, but Calderdale is also a great approach to workforce redesign. It includes understanding the different approaches. Having a key approach includes change management, culture change, but it also includes making sure that you can develop workforce plans. It also includes making sure you can model your workforce. It includes making sure that you can understand workforce data. It also includes ensuring you understand diversity, can build leadership skills, can be good at facilitation, etc., etc., etc. It's a massively broad area. Workforce transformation, when you're working across a system, typically fits within the areas of the green box on the left-hand side. So workforce redesign or workforce planning within systems can just be a part of redesigning your system as a whole. So, for example, if you have new digital solutions, if, like, for example, new patient access systems, for example, if you change your processes, like introducing a frailty pathway, if you add a local CDC, then you're changing the buildings. If you are changing your organization, so you may, for example, form closer relationships between providers or between other elements of your system, then those will all have a massive impact on workforce. Then you've got workforce redesign, which is where you then really need to undertake the sort of detailed role redesign that things like Calderdale, CLEAR, 6-step and RAPT allow you to do. So that is the more detailed stuff around who does what. But a lot of our stuff around workforce redesign comes from the fact that your system changes significantly, it becomes more efficient. Then there are other skills needed around planning, but also the bottom one, which we could potentially put in the green circle, is about the infrastructure and support to doing workforce redesign. And that includes things like workforce hubs, such as Manchester's Health and Care Workforce Hub, which is helping coordinate activity across systems. So those of you, quick question, I'll ask a couple of you if you can come up with a few examples, but those of you on the call, what sort of barriers do you see to trying to do workforce planning at any level? Any thoughts? You just shout them out. Financial planning and costing. I can see Yasmin has put hers up, so yes. Money, there you go.
Well, there you are. It's not just about the money. I just generally, and I hate to say this so publicly, but I will anyway, I don't think we have enough of people who understand and can carry out workforce planning. I just think our workforce departments, our HR departments, whatever they're called now, have just been depleted of that resource and of that training. So what ends up each year is for finance to do the workforce plan as well as the money. And what do? We do half good job. We'll go, well, you're not productive enough. The workforce is too high for what I need output wise. Well, it's half of the story, obviously, and it's key part of the story, but it's not fully triangulated. So that's the missing link, I think.
Brilliant. Yeah, I mean, you've come across three there as far as I'm concerned. Not enough skills, the lack of alignment with finance, and money in general. They're all not enough money. I think they're all three. They're all things that we find a lot, and it doesn't surprise me you've came up with that. I don't think you're being controversial. That is a massive problem at the moment. Brilliant. Well, they are massive problems.
Thank you.
Great stuff. You can tell you're in workforce planning. Anyone else got any that they'd like to raise?
There are a lot of comments in the chat. Colin, if you want me to read them out.
Go on, quickly read them out for me. That'd be great.
Okay, I think what we've got is finance and data quality. Change fatigue, detractors, not the appetite, traditional role profiles, professional silos, changing landscape with unclear service strategies. The teams COD and workforce planning. Workforce planning as a barrier. Not enough funding in HR and operational staff.
I'll tell you what, that is enough. I think you have definitely got the point here. I think you've absolutely got the point here. It's no lack of engagement here when you talk about what the issues are. When we're training on it, we always start by looking at what the issues are. And I've actually written an article on why workforce planning is impossible. And you guys have come up with some new ones. Change fatigue, I can argue, is an element of some of these. Those professional silos are good ones. One of the ones that you sort of mentioned there, didn't use quite the same thing that I've put here, is that people don't care about workforce planning because it's not something people focus on, and there isn't enough attention paid to it, I think was the phrase you were using. I think that might be the right way to put it. So yeah, huge problems. There's a lack of alignment with finance. People don't really care about it. They're worried about money. They're worried about making sure there are no major bad events, but they're not necessarily worried about workforce planning in the long term. There isn't a lot of money out there, and we want to do double running, and et cetera, et cetera, et cetera. So how on earth do we do all this stuff? In a system, there's complex overlapping boundaries. Be interesting to see whether things change, but who is in charge? And everyone's got competing priorities. There are a lack of skills, as Yasmina mentioned. We need to do some pretty bold change. And if we haven't got the skills to do that, haven't got the time to do it, haven't got the money to do it, then there's a problem. We have a lack of people generally on the ground in general, not enough time to do it. And yes, a lack of data and data sharing, data governance can get in the way rather than helping us to get our work done. In general, it's really, really, really tough to do. And certainly when I'm working with the association, it's about trying to help people to get around these barriers. And that's what we try to do. But I've been very interested to work with Olu and the team on their system because before we even get into the concept of workforce, the fact that it's all linked together, I think, is a bit of a potential silver bullet here for health and care workforce planning. Because, and this is their diagram here, financial planning, supplies, workforce, demand and capacity, integrated plan and performance, all in one place. If we are linking activity, if we're linking workforce and we're linking our money together, and we have a single set of integrated plans that are going to affect all of these things, then I think you've got a real solution here. Because if this is the one thing that's being looked at from the front line all the way down to the board, then you've got one integrated plan, you've got proper governance around this stuff. What you've also got is alignment, because you won't be able to have frontline plans developed that don't align with finance. So you won't get to that situation at the end of the process where you're saying, right, who wins, finance or workforce? spoilers, finance always win. So realistically, you're having those conversations at the ground level in the same way we used to in service line management, for those of you that are old enough to remember that. So what you've got is single governance. You've got to focus on this so people actually start to care about it. There's actually a process for workforce planning. Everybody on the ground needs to do it, which gives us a chance to rebuild our skills. People used to have these skills, but because there's been a lack of focus, there's been a lack of development in these areas. There is real chance of alignment between the areas, and I'm not naive enough to think that will be total alignment, but I think it will be. Yeah, it will be much better. And I think the key thing through that governance, through people caring, through having a process, there's two things we might be able to drive. One is we might actually be able to drive transformation and potentially whole system workforce transformation through it. And secondly, you will get the application of the things that you need. We always say we need more teeth. What you need on this is more money, more time, more management focus, more people. And I think a tool such as the team are developing at the moment will have a really, really big impact. I'm sure these slides will be going around afterwards, but I just want to flag to you before we get into a quick demo video that the team have prepared. I just want to flag to you that there are a number of resources out there if you want to more. The key one I want to flag is the Association of Health and Care Workforce Planning, which is a free to join system on the other free to join membership organization, which has lots of information on how to do things and has a modeling center of excellence within it, which includes the wrapped tool. And if anyone's got any questions or want to talk anything to do with workforce planning, please email me at any point at colin.lewry@carados.com. And the book is there on the top right hand corner for anyone who's interested. So quick run through from me. I know there's a video to be done and then there's time for questions, but if there are any, I think if we perhaps move to the video first and then questions, are we?
Yeah, thank you very much, Colin. I'll play the video now then. We'll take questions from the audience. Can everybody see my screen now?
Yes.
Yeah, sorry, I have to scroll through all the slides. Yeah, to enable. Anybody hear the video?
Yeah.
Okay. Yeah, thank you. That's the end of the demo. And just to share with everyone here that we had a focused one done within our A&E department for this connected planning project. And we saw tasks that once took hours reduced to seconds, delivering significant time savings, and also reducing the potential cost from by about 7 million annually by replacing bank and agency staff with 67 WTE. So meanwhile, it was also standardizing their workforce alignment across different sites. So creating a single source of truth. So this boosted visibility, confidence in planning data, and resource optimization as well. So this is just an example of where that has happened. So I'll stop sharing my screen now. We take more questions from the floor before.
Ollie, you've got one on the chat already.
Okay.
Louise Gallagher. Does the activity tool use the same methodology as the national productivity tools?
Yes. What we've done is we've inculcated we've worked with the productivity within NHS England to make sure all this, the demand and capacity model captures the same framework that is recommended from the center. And as well, inculcating this at the local level, individual trust level with the various SMEs, trying to see how do they do their planning in real time compared to what the national recommendation is. And we've inculcated this into the tool. Although one thing I would say, we can adapt the tool to different specific organizations, but there's a starting point that we have done for this, everyone to adapt. So I've got your hands up, Yasmina.
Yes, hi, sorry, it's me again. I hope you'd spotted my cheeky chat. Will you actually hand this out to everybody? That was one. I know the answer is no, you want to make some money out of it, but just a little bit of money. Secondly, just very quickly, we have got a lot of this information already in our rostering tools, okay? So we have all our medical force, our nursing force. We are not using them properly. We don't import activity, we don't import other important things, which as a trust we will be working on that during this year. So it did feel fairly complex, if I'm going to be honest, just from having that overview here. Brilliant as it might be once we have the right person to manage all this and focus on that, but it does seem, and also as I said, we have a lot of this in our rostering systems already, common rostering systems that everybody uses across the nation, because we know there's only a handful that are going around. So I'm just worried that we might be ignoring something that we have for the sake of something else. There is much more we can do locally. That's just my observation. But thank you so much. Such a good, obviously, product. It's about the integration, isn't it? Everything needs to balance. But yeah, thank you so much.
Yeah. So just to comment on what you said, thank you very much. I think the question is, what are we doing with the data we've got within those various systems? And what this system does for you, it brings out those data, puts it in an intelligent format for you to make decisions that impact both the staff and also the patient outcomes that you have within the organization. So we may have data within those. This doesn't replace the rostering system. It just takes in data for you, puts it in an intelligible format for you to make good decisions and for your plans, for your activities in your local area. Colin, I've got your hand up.
Yeah, just a quick couple of things I wanted to say. I think first of all, just to say that what I like about working with the team here is that they've got this tool and a plan, and then they've got the system which sits on top of it. But where I've been sort of suggesting changes, they're able to make them very quickly. So actually, a lot of what you've seen is a work in progress. But they're able to make the changes quite quickly, which is means it's quite able to be very, very responsive to your own requirements within it. I think in terms of that other point there about the rostering tool is that rostering tools are not standard, even though that there are only a few. They're not as standard. And what we really need to do is to be able to pull all this together, information together into an area which allows teams on the ground. So the lead for each team, be that the lead clinician, medic, nurse, AHP, and manager, to be able to undertake their own planning within their teams and then to scale that up to the center. And that's what this tool will allow you to be able to do. So yeah, absolutely, you're right, Yasmina. There is a degree of complication. By having a tool like this, you'll be able to build standard skills in managers to be able to do this sort of thing. And actually, you'll find it won't be as difficult as you think on the ground.
And just to I think there's a follow-up question from that also that says, the NHS workforce planning tool fed by ESR, not a system workforce planning model, as it doesn't include the workforce from other system partners. No, it does. It's fed by ESR, but it can be fed by multiple data sources from the FDP, from other local system partners working across the community place systems. So it can be fed across with data across other system partners as well. So it's not just fed by ESR, it's fed by multiple data sources, and you can work across systems with it. I hope that answers your question. That's from Gaynor Clark. Go ahead, Colin.
The wording is quite, you're right, though, actually, in terms of the way you're getting across this. It talks a lot about NHS, and the wording is there in ESR, for example, which is one source. As Olu says, actually, you can also do it through standard uploads from any system, but appreciate the wording is actually very NHS-y on there, which is something I have to take back with the team, Olu, I think.
Yeah. Thank you. Do we have any more questions? Yeah, please, I've got a comment there that says, this is great. It'd be good to see the tool in more detail to understand how the tool handles workforce data. That does, yeah, we are very, the contact details are in the chat as well. So please feel free to contact us. We would like us to work with you directly on this. There's an opportunity to get this, have a sort of proof of value before you maybe get onto, and if it works for you, we can develop a business case together with you before you go ahead and take, maybe use this scale this within the organization. So please, it enables, and as Alison commented on the chat now, it enables place and multi-agency collaboration as well. Yeah. Thank you. Any further questions on the chat or comments? And I cannot see any other question in the chat to answer. Okay. Yeah.
Thank you the last one. get paid for what we actually have, but yeah, no, very, very good. We're moving already, lightning speed to do all of this. We do know what a good workforce looks like. I think on the last point, I would have just said, while having done lots of workforce planning with the team over the last years, nursing was relatively easy. I found medical staffing incredibly difficult because their responsiveness, there isn't one doctor to so many. There was missing that good guidance. What does it actually look like? Okay, in practicality, it all depends on the day, how many emergencies you get through the door and all of that, but you can explain that. How do we actually zero base and plan? What does right look like? That was missing. Nursing was so much easier because, there's lots of guidance and we got that right. And believe it or not, we didn't overspend a penny this year on that. So here we go. Good patient outcomes, the whole thing works. But it's that guidance about the medics, I think, critical bit for us to crack.
Absolutely. And Yasmin, I think that sort of goes back to my point about workforce planning is such a massive area, and actually whatever system comes up has got to work with all of these different things. So yeah, for your role, what you've got to do. For the frontline person who's trying to balance stuff, they might not. For the person working to redesign between different roles, they might not. And I think that's the great thing about trying to get this as part of an integrated thing is that we can consider all the different elements of workforce planning and make sure the system helps with as many of them as possible, as simply as possible. But yeah, great. It'll be great to catch up, Yasmina, actually, about some of your stuff.
Yes, I've got your number. I've got your email.
Excellent. It'd be great
Thank
to
you.
Thank you. Thank you very much. Yeah. And thank you everyone for joining the webinar. The videos will be available, and please feel free to reach out to us. The contact details are in the chat accordingly. We'll be happy to discuss further. So thank you once again, everyone. Bye.